Okay. Okay, everybody. My name is Dr. Michael. Thank you for coming out. I appreciate you all taking time out of your Saturday to come listen to all of us gabber. Hopefully you learned something from everybody today, and I'm going to be talking about bone health for runners. Now, before I get into the meat and potatoes of the presentation, I want to address the term bone health because I think when most people hear the word bone health, the first thing that comes to mind is osteoporosis, right? Osteoporosis and low bone density. And that is relevant for what I'm going to be talking about today, but it's not going to be the focal point. So the focal point of the presentation is going to be bone stress injuries and bone stress reactions and why that's relevant to runners and how to be mindful of it and things of that nature. So we won't be talking directly about osteoporosis, but the topics of the presentation are going to surround bones and bone health. So you'll get a little bit of that in there too. So let me introduce myself a little bit further for those of you who don't know me. My name is Dr. Michael. I'm a PT here in Evanston that specializes in working with runners. I'm a triathlete at heart. That's kind of how I got into the endurance sports. Fell in love with the running component, but I've competed in a handful of various endurance events, and I've taken my passion for the endurance sports and I've brought it into my private practice, Valiant Physical Therapy, where I specialize in working with runners. And in my clinical care of runners, bone stress injuries are maybe the most stubborn and difficult to work with. And I think that this quote here is really applicable for what I'm going to be talking about today, in that an ounce of prevention is worth a pound of cure. It is a lot harder to rehab and treat a bone stress injury compared to doing a little bit that can go a long way to actually prevent one. So in my conversation, in my presentations today, I hope to provide you all with that ounce of prevention so that nobody has to worry about finding that pound of cure. Okay, so the objectives of the presentation: define the term bone stress injury. Why do I keep saying that, and why am I not saying stress fracture? What do bone stress injuries feel like? How to tell if you have one, what causes them, where do they happen, what to do about it, and then, of course, how to prevent them. Okay, and before I get deep into the presentation, I have to give a huge shout out to Chris Johnson and Nathan Carlson. They are two nationally renowned running physical therapists. Maybe some of you guys have heard of them. Chris Johnson's pretty famous in the endurance world, and they both have a podcast called The Runner Zone, and it is geared towards clinicians like myself that treat runners, and they have basically taught me everything I know about bone stress injuries. So I have to give a huge shout out to both of them. And then I recently got to meet them both in March. I took a continuing education course with them in Boston, and I learned some more there. So I have to give a huge shout out to these gentlemen here. Okay, so let's get into it. Why am I talking to you guys about bone stress injuries? Why did this topic come up and not anything else that I could have talked about? Well, the story begins with myself. We rewind about 2 years ago. I was doing a mental toughness program called 75 Hard. I don't know if anyone is familiar with that program, but there's a lot of different daily tasks that you need to do over the course of 75 days, and you have to do them every single day, and if you miss any of the tasks, you have to restart from the beginning. So it's basically a 75-day, sprint is probably a hard word, but of doing these daily tasks. Okay, I'm not going to go through every daily task, but two of the daily tasks are to do 2 workouts, 45-minute workouts per day, and one of them has to be outside. Okay, so one 45-minute workout outside, and then another 45-minute workout of your choosing. It could be inside or outside. There's another component where you have to pick and follow a diet. Okay, so some degree of restricted eating. Okay, so I was doing this program. I was doing a lot of my walks and my runs outside, of course, and as I was making my way through the program, I started to feel a little bit of an ache in my leg. And I was like, okay, no big deal. All right, I'm just going to keep going. I don't want to stop because if I stop, then I have to restart. So I'm going to keep pushing. And I know we're all very familiar with that mindset of, hey, we're just going to keep pushing through it. Hey, I don't want to give up, right? I don't want to give up on this. So I keep going. It's getting a little bit worse as I'm going about it. Once I finished the program, successfully completed the 75 days, I'm like, okay, let me take a little bit of time off. Let me not exercise as hard, and then this thing will kind of go away on its own. Well, it didn't. And it kept lingering and lingering and lingering and lingering. Weeks became months. Months became a year and a half. And it just kind of stayed there. And I was like, what the hell is this thing? Why is this not going away on its own? And it wasn't until I really learned a lot about bone stress injuries that I realized, oh my God, this is a bone stress injury. It wasn't necessarily a stress fracture, but I'm going to kind of get into, how did that happen to me? What were some of the things that, what were some of the variables that were in play that led to this happening? Why did it last so long? And if you feel some of those warning signs, maybe you can prevent it in yourself. So, and this is very relevant for us as runners to talk about bone stress injuries because the general athletic population has a stress fracture risk of 1 to 2%, so it really doesn't happen. But in runners, we have an incidence of about 20%, okay? So much, much higher, okay? And so it's very relevant for our sport to be talking about bone stress injuries and stress fractures, okay? So, I want to, in tying in with this statistic here, it's like, okay, well, why do runners have a higher incidence? I want to compare the two sports of soccer and running, okay? So obviously a lot of differences between the two, but I'm just going to boil down the ones that are relevant for what I'm talking about here. Okay, so for soccer, as you know, it's three-dimensional. Okay, you're going forwards, you're going backwards, there's lateral movements and all these kinds of multi-directional parts of soccer. Okay, with a sport like soccer, there's bursts of energy and then there's breaks in the game. Okay, if the ball gets kicked out of bounds, if it gets passed to your teammate, to the other team, you're not constantly moving. There are times where, players will rest, catch their breath. Maybe they're not the one with the ball, so they don't have to run as fast. They're not chasing it. So it's three-dimensional and then there's breaks. For running, it's the exact opposite. It is straightforward. And God forbid we find ourselves on a curve, okay? We don't like to turn. We want to go straight forward. Let me find the straightest path I possibly can, and that's where I'm going to just go up and down, up and down, up and down, right? We don't like to turn. So it's straight ahead, all right? And it's constant, okay? And there's even a part of the runner's psyche that says, no, don't stop. Keep running. Don't take the break. Don't take the walk break. I want to run the whole time. I don't want to have to take a break. Right? So there's a little bit in there where not only is it straight ahead and we're trying to be as constant as possible, there's that internal driver that says, don't stop, right? So that's the difference between soccer and running. Soccer, three-dimensional and there's pauses. Running is constant and straightforward, okay? Soccer players have to worry about ACL tears, right? You hear about people in these bigger sports tearing their ACL. When have you ever heard a runner tear their ACL? It doesn't happen, okay? So we don't have to worry about ACL tears. What we do have to worry about are the bone stress injuries because of the nature of the sport, constant and straightforward with no rest, that the bones just get a little bit more of that load than, say, like the ACL, okay? So I've been saying the word bone stress injury a lot, but what the hell is that, okay? So bone stress injuries can be boiled down into two basic terms and ideas. And the first one, I'm sure most of you already know of, are stress fractures. Okay, stress fractures, very obvious. Most people know what that is. It's basically, all right, you take a healthy bone, you run too much, and then you get a stress fracture. This is basically the extent of the layman's knowledge about bone stress injuries and what that is. It's you run too much and you get a stress fracture, and that's it. Okay. My hope today is to shed some light on this other thing, this mysterious behind door number 2 term. That is kind of what I had and what I think a lot of people might actually be dealing with without even really knowing it, and that is a stress reaction. Okay, so a little bit anticlimactic because the word reaction is kind of vague, right? So, okay, stress reaction, whatever. But so what's the difference between the two, okay? If we take healthy bone, okay, and this is a spectrum, and we load it, okay, and we load the bone, we'll get to a point where once the load is too much that the bone can't really recover and handle, you're going to start to actually damage the bone a little bit, okay? There will be some degree of injury to the bone, and it's going to fall into this category of stress reaction. I'm going to further define the difference as I continue to talk, but basically you can know that as the load continues to get higher and higher and higher and higher and higher, then you'll get into the stress fracture, right? So the stress fracture is when there's actually a fracture line. This is really hard to see. I knew this wasn't going to come up super well, but basically there's a crack here in the bone, okay? This is an x-ray of someone's tibia, and if this image was like perfect, 1080p quality, you could see that there's a crack right here. I'm not sure how well you can see it in the back, but I can't see anything up here. There's nothing. But anyway, so there's a crack right here, okay? And that's a stress fracture, okay? There's a crack, a fracture line. The bone is broken. In that spot, there's a fracture right there, okay? A stress reaction is going to be way more subtle. They usually don't show up on x-rays, but this is an image that I found that actually does it pretty well. I bet you guys can barely even see anything here. There's a little bit of swelling right here at the bone, like a little bit of almost like calcification, there's some fluid there in the bone. So both stress fractures and stress reactions, so stress fracture, stress reaction, are bone stress injuries, but the stress fracture is the one with the fracture line, okay? The stress reaction are graded mild, moderate, and severe, basically how much swelling is on the bone, okay? So let's take, for example, Achilles tendonitis, okay, right here, all right? Ah, my Achilles hurts. What's going on at the Achilles? The Achilles, the tendon is irritated. With bone stress injuries, there's a problem on the bone. The bone is inflamed. The bone is swollen or it's cracked. Okay, so this idea of a stress reaction is not very commonly thought about in our community because it's a little bit hard to understand and it's kind of vague. And yeah, go ahead. You said this is the swelling is due to moisture in the bone. It's more just irritation at the level of the bone. So I don't know if you can think about it like a pocket of fluid. I don't know if that's really the right way to think about it, but the bone itself is like swollen, but it's not necessarily filled with fluid. It's irritated is a way you can kind of think about it, okay? So yeah, so stress fracture, stress reaction. Stress fracture has the crack. Stress reaction is going to be a little bit more vague. They really don't show up on x-rays. This is a rarity. MRI is the gold standard for diagnosing the stress reactions, okay? But obviously the x-ray image that I showed you kind of hits the point there, okay? So what are signs of bone stress injury? I've kind of defined the two terms, but what are signs of bone stress injuries? There's two different categories. Let's keep our focus over here on the orthopedic for the first part, okay? So orthopedic, going to be pretty obvious. It hurts. Something hurts, okay? But how does that pain actually present? It's going to be a specific point of pain that's likely over a bone. So that sounds super obvious, but it can fall into this category of like, I could keep running. It's not that bad. There's something there, but I don't have to stop. I can keep going. Point pain, okay, it's right here. I feel something right here in this spot. And if that spot is on a bone, you likely are dealing with some degree of a bone stress injury. Doesn't mean it's a stress fracture. Doesn't mean there's a crack in the bone. But maybe there's some irritation at the level of the bone itself, okay? If it feels achy when you stand or weight bearing, okay, you're just like, I kind of feel like sitting down. My leg's getting kind of achy, all right? The pressure that you're putting on the bone is getting irritated. The bone stress injury is getting irritated by the pressure you're putting on it, okay? And then achiness at night too. After a long day's work, you kind of feel like, oh man, my leg's kind of achy. This one, changing position doesn't help. This one's kind of nuanced. You can't really find a comfortable position no matter how you move the leg. It just kind of always stays there. You can't find a spot that feels better. It's kind of achy all the time. Worsening pain while running. This sounds kind of obvious, but we're all used to starting the run and it's like, oh man, that doesn't feel too good. But then magically it just kind of goes away. And then you can kind of run through the whole thing. And you're like, oh, that went away on its own. Great. We love when that happens. This doesn't happen. That doesn't happen with these, okay? It's there at the beginning, and it's definitely getting worse as you're running. And I kind of want to finish the run. I'm pushing. Oh man, this thing is definitely worse, okay? That's not a great sign, okay? And then very clinically, pain with jumping. All right, so one test for ruling out bone stress injuries is just having someone jump up and down on one leg. okay? Someone that has a bone stress injury, likely, if they're jumping up and down, it's like, oh, ow, ooh, okay, no, that doesn't feel too good. If you can't jump on one leg, you can't run. Running is a series of single leg jumps, okay? So pain with jumping is not going to be too good with these, all right? So that's kind of all the orthopedic sides, but when the bone is involved, there also is a hormonal component to this, okay? And there's also some hormonal signs that we'll be able to look out for to think, okay, is this actually a bone stress injury? Is there something going on with the whole hormonal system along with the bones? And for men and women, there's differences. For women, it's going to be a missed period, okay? So if you miss a period and you're dealing with these kinds of aches, there's something wrong with the hormonal system, okay? So that is a sign of bone stress injuries in women. And for men, it's going to be decreased sex drive, decreased frequency of shaving, and then lack of morning erections, okay? So not only are there these categories of physical pains that you kind of notice, but there's also a whole group of things that are like, oh, that's a little weird. I didn't realize that that was related. I thought that this was kind of normal. I'm pushing really hard in my training, and yeah, it makes sense for me to have a little bit less sex drive. I'm kind of tired, or I thought it was normal to miss a period if you were training really hard. Sometimes people can think in those ways, but none of these things are normal, okay? And they're all related to the bone and bone health, okay? So what contributes to these bone stress injuries and how do they happen, okay? From an orthopedic side of things, it's actually kind of obvious, right? So training load, too much, training intensity, too hard, training frequency, doing too much, right? So if you're running 5 days a week or 7 days a week, maybe you run every single day, okay? Maybe you're only running 2 days a week, it's a little bit nicer. But if your training frequency is really high, then that's going to put a lot of load on the bone, not a lot of rest associated with that. And then the training surface, are you on treadmills all the time? Are you on gravel trails? Are you on the dirt? Or are you on concrete and asphalt, right? And so all that kind of plays into it, all right? From a hormonal side of things, this is actually where things get really interesting. And this is often the overlooked component of treating these injuries is all the stuff that's not running. So that's all the running stuff. This is all the stuff that kind of happens, in and around running, okay? Low energy availability, which is fancy talk for not eating enough, not getting enough calories, not fueling properly, not resting enough. So if you're training really hard, you're putting a lot of stress on the system, on the bones, and then you're also not really eating enough and not resting, your body has no fuel to actually recover. So you're just draining more than you're filling, right? So sometimes people will stop running, but they won't address any of this stuff, and it just kind of stagnates, all right? With or without disordered eating. So this means that you don't have to be anorexic, you don't have to be bulimic to have any sort of a fueling problem as it relates to this, okay? Low bone mineral density related to osteoporosis, right? So not just people with osteoporosis are going to get something like this. If you're calcium or vitamin D deficient, that's going to become very relevant. So when I'm working with someone who has a bone stress injury, I'm quickly sending them for blood work to say, okay, let's see what your calcium levels are, let's see what your vitamin D levels are, and let's make sure that if there's any deficiencies in those, that you're supplementing that, because that's actually going to help heal the bone, right? And then stress, if you have a really stressful job, okay, that's going to contribute to the hormonal balance in your body, so it's going to be harder to recover. And then if you have poor sleep, poor recovery, that kind of goes without saying that you're not really going to recover very well. So if you're constantly on the gas, you're running really hard outside all the time, and you're also not fueling correctly, and maybe you have some stuff going on like this with calcium and vitamin D deficiencies, the scene is set. So going back to what I was talking about earlier with my 75 hard program was I was outside on my feet every day. That was part of the program, outside on my feet. I was on concrete, walking or running, okay? So we're talking about load, intensity, frequency, and surface. Those are strikes against me in all of those, right? And then from a hormonal standpoint, the diet was part of the program. So I was eating less, okay? I'm lactose intolerant, so I avoid dairy. So I never got my calcium tested, but my suspicion was that I was calcium deficient in some capacity. I don't eat dairy, okay? I was stressed because I was building a business. I was living by myself. I was doing all the cooking, cleaning, and all that kind of stuff on my own. So I was doing a lot, and I had to wake up really early in order to get all these things done in the program. So I wasn't really sleeping very well, and my recovery was pretty poor. So everything was set up for me to get something like this, right? But I didn't even realize it. I was like, I'm just training. I'm pushing really hard. Like, I want to complete this task that I set out for myself, right? So, but the scene was kind of set. All right, so where do these injuries happen? I've mentioned bone and bone stress injuries, but actually where, okay? So there's two different categories of locations for injuries like this. The first is high risk. The second, which is on the next slide, is going to be low risk. High risk locations, if we're suspicious that there's a bone stress injury in one of these high risk locations, we got to get the person on crutches, okay? It's a big deal because if you keep putting weight through these areas, if there's injuries in these spots, then the bone is going to have a much harder time healing. And if it doesn't heal properly, you can have long-term complications, okay? So these are areas where if I'm suspicious that someone has an injury here, I'm saying go to CVS on your way home, pick up some crutches, and make an appointment with an ortho, okay? So femur, okay, kind of hip, high hip, the front of the tibia, the ankle, and then some bones in the foot. Okay, it's basically navicular and all those kinds of things. All right, so those are the high-risk locations, and then the low risk is going to be the pelvis itself, the shaft of the leg, okay, the posterior medial tibia. So this is where I had mine, and this is also the most common location for stress fractures is in the tibia. Okay, so mine was right here. And then calcaneus is the heel, and then some bones in the foot. Okay, so I want to pass out these real quick. So I'm going to go through this, but let me just have you guys, everyone gets one note card, and then I don't think there's enough pens for everyone, but I'm just going to kind of, here's 2 packages of pens. Just kind of share the pens. Yeah, here's some over here. And here's a bunch of pens. I think there's enough pens for all you guys. You can kind of just open them up. If you guys have pens, yeah, great. Just share the pens. I don't think there's going to be enough, but there should be enough note cards for everybody, okay? So everyone gets a note card, and then maybe you're going to have to share some pens. I don't think there's enough pens for everyone. Okay, we're going to need that later, but just kind of start passing them out now. So I want you to imagine, this is choose your future, okay? I want you to imagine you're running your training, and you remember some of the things that I talked about during this presentation, and then maybe you start feeling some warning signs. And maybe you're like, okay, Dr. Michael was telling me about point-specific pain over a bone that hurts worse when I jump and run. I think maybe I might be feeling some of those things. So if you're kind of here at the warning sign piece, okay, you really have 2 options, okay? You can go in like I did, after I did my program, and I just kind of ignored the pain, and I thought it was kind of go away on its own. And then what you start to do is what we all do is we say, all right, let me take a couple weeks off running. Let me decrease my volume. I'm going to run on the treadmill so I'm not outside. So you're kind of making compromises in your training, which ultimately leads to training that you don't enjoy. It's suboptimal, and you're just trying to baby it. But what these things actually need is for you to pause running, because the jumping and the impact is one of the key aggravating factors. So what will happen is you go through you feel the warning signs. I kind of feel it. You ignore it. You try to modify. You do some suboptimal running, and then if you just kind of stay in this cycle, you're just here. And this is where I was for months. And then I got to a point where I was like, what the hell, man? I'm just in this. I can't figure out what's going on here. And it wasn't until I realized that, you know what? I had to stop running in order to actually make the path towards healthy running, okay? And that is a very difficult thing to come to grips with, because we, in the running community, we admire consistency, we admire pushing through it and really finishing what you say you're going to do and finishing what you set out to do. And stopping running isn't just about not exercising, it's almost like you're giving up. Right? And that's hard to do, but it's necessary in order to get through to the other side where the bone is healing and you're actually running, okay? So being very attuned and astute to the warning signs can get you to say, okay, hold on, I think I actually need to stop now. You do the rehab process, and then you can kind of get to healthy running faster. Otherwise, if you have the warning signs, you actually have a bone stress injury, and you just stay in the cycle, this cycle doesn't lead to that. You have to go through here, which means pausing running, which sucks, okay? It sucks. So you don't want to do that. So if you start to feel something, take action. Okay, so how do you prevent something like this from happening? Okay. One of the key things is actually ensuring proper fueling. So making sure that you're eating enough, you're getting whatever vitamins and minerals you need for your specific body. For me, it meant supplementing calcium for some amount of time, and I also supplemented vitamin D. I never tested deficient in either of those things, but I started taking them anyway. This is where I refer off to dietitians. A dietitian is a very important person to have on your side with something like this, because there's all this food and fueling component, okay? You're gonna wanna monitor your training load and avoid overtraining. So that is really, there's a lot of nuance to that because everyone's abilities are a little bit different. Everyone's capacities are a little bit different. But just be aware if you're like, man, I'm really pushing on the gas here. I'm training really hard. I'm tired and I'm really exercising really hard and blah, 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 blah. You're gonna kind of wanna be mindful of that and be careful, okay? And then heavy, slow weight training, like Chris was talking about earlier, really good for bone density, okay? So for anyone interested in learning more about osteoporosis, heavy, slow weight training and plyometrics are going to be two treatment modalities, two exercise modalities that will improve bone density, okay? Plyometrics is sometimes difficult to program, so I put this be mindful there because there's a lot of ways you could do jump training wrong, and I don't want to tell everyone in the audience, just start jumping and it'll all work itself out and your bones will be healthier for it. There's a lot of nuance to the plyometrics, so make sure you get some good guidance on how to actually introduce that. But doing this weight training is probably the lowest hanging fruit for a lot of people. Making sure you're eating enough and then doing some heavy resistance training. So I'm not talking 2 pound, I'm not talking about the pink dumbbells. I'm talking about the black ones, okay, that are on the rack next to all the other scary ones, okay? Question? Calcium and vitamin D. Yeah, but I'm going to just say disclaimer, I'm not a dietitian, okay? So I can't tell you to take any of that stuff. And there's also some people that say there is such a thing as taking too much of both of those. So I'm going to say consult your healthcare provider. Okay? My bases, I think, are covered. All right, so what do you do if you get one? Okay, so a bone stress injury, okay? Consult medical professionals is the first thing, okay? So don't try to fight this on your own, okay? ChatGPT and Google are great, but you need someone that's going to work with you individually. And whenever I'm working with someone with a bone stress injury, I make sure I can get in touch with their ortho. I send them over to a dietitian, and then I'm obviously working with them as the physical therapist. And maybe the person needs an endocrinologist if they have some known hormonal imbalances, just like as a prior medical history standpoint, because if the hormones are not really cooperating, it's going to be difficult for the bones to be calibrated in a good way. Okay, so what to do if you get one? This is kind of the rehab process that I'll bring someone through, and it starts with the unloading, which is the worst part. This is where people get really bored and they start to lose their fitness. They start to put on the pounds and they're like, oh, come on, like I want to stay active. One thing that people do incorrectly with rehabbing these is they'll stop running, but they'll just start doing a whole bunch of other stuff. I'm gonna go on walks now. I'm gonna bike a lot more. Let me go and do the weight training, okay? All of that is load on the bones. So when you have one of these and you actually need to like kind of stop doing basically everything, okay? Which really sucks, okay? But that's the first part because you need to get to the point where you're pain-free with activities of daily living. You want to be able to walk around without any discomfort, okay? You should be able to walk around without that achy feeling in your leg or whatever, okay? Then you're going to go through a progressive exercise program that is intended to load the bones. Then you're going to go through plyometrics, some jump training. Then there's a return to walk, run, and then return to competition. Okay, this takes time. This takes time. And what a lot of people do is they think, oh, I think I have a bone stress injury. Let me take a couple weeks off running, okay? And maybe they take just a hard rest of everything. And then they just jump right back into what they were doing, okay? There's a whole flow that we need to be mindful and respectful of, because if you just go back to running, it just comes right back. And it just kind of lingers. So it's important to kind of go through the process in a specific way. Okay, so we all got our note cards, and hopefully there's enough pens around for everyone to kind of play around with. I just want to invite you guys to write one change that you commit to making to protect your bones this running season. Okay, marathon season hasn't quite started yet, but there's a handful of things that each and every one of you can be doing to think about your bone health and how you're going to prevent an injury like this from happening. So just take a second, write down one change that you commit to making to protect your bones this running season. This is private to you. You don't have to share this with anyone. A handful of ideas if you're kind of stuck. You're like, oh, wait, I wasn't paying attention very well. So what did Michael say? Monitoring your training load is huge, okay? Being aware of the warning signs and taking action. If you think that you have one of these going on, talk to someone about it, okay? Talk to your doctor. Say, hey, I think maybe I have a bone stress injury in my leg, and I'm not really sure, okay? But what's one change that you commit to making to protect your bones this running season? Fold that up, put it in your pocket, read it before you go to bed. Read it before you actually get into a big training cycle and say, here's what I'm going to do to actually keep myself safe. Yeah, question? I actually stopped for 12 weeks. I stopped for 12 weeks because I was trying to get to the point where I could walk without any pain. So this is what I did based on the teachings from Chris Johnson and Nathan Carlson, who taught me about rehabbing this injury. So what really sparked it, if I could tell a quick story, was we were coming back from Colombia in January, and I remember walking in the airport, and we were walking for like 30 minutes, okay, to get from one side of the airport to the other. And by the time we got to where we were going, my leg was so achy. And I was like, Michael, you can't even walk for 30 minutes. What are you doing trying to run, right? So it's one of those things where you can kind of push through it. You can kind of keep going, but the signs are there. And if you listen to them, then you can get back to running quicker, okay, if you go through the right process. So here are the main points, okay? Bone stress injuries are a spectrum which include both stress fractures and stress reactions. So it's not just when the bone breaks because you run too hard. There's also injury at the level of the bone called stress reaction that is a result of doing a little bit too much and not fueling properly, okay? Runners are at a higher risk for these types of injuries just based on the nature of the sport, okay? Point-specific pain over a bone that hurts more with jumping are key orthopedic signs, okay? Hormonal symptoms are also present with this. So women, if you miss your period, men, if you notice decreased libido. Overtraining and underfueling are key contributing factors, right? That's the double devil. There are high and low risk locations throughout the bones of the lower leg and body. Lifting weights, monitoring training load, and eating well will deter bone stress injuries. All right, so it's kind of important to keep all those things in check. If you think you have one, don't ignore the warning signs and get some help. Okay? If you think you have someone or you know someone that maybe is having trouble with something and it might be a bone stress injury, here's how to get in touch with me. You can ask me questions after this presentation for everyone to hear. You can talk with me one-on-one after the presentation. That's my work text number, my email, or you can go to my website, valiantphysicaltherapy.com, and schedule a free call with me. And I think that's all I have. So does anyone have any questions? I went through a lot. Yeah. Mm-hmm. So good question. So the question was, if you have a stress reaction, do you recommend icing? It's not gonna do anything. You need to take the pressure off the leg. So the act of elevating the leg to put ice on it is going to take some pressure off. So that is good. But the important thing is going to be to edit your training and to really make sure, okay, if you do have one of these injuries, you're going to have to unload it. So it's not so much that ice is going to fix it. It's that you need to take into account everything that you're doing to stress that area. Does that answer the question? Yeah. Okay.
How do you know that the achiness that you got is not from the bone, not from the muscle?
Yeah.
And also, like, if it's happened, like, some people thought it's from muscle and you keep massaging.
Yeah.
It's gonna have like any.
That's a really good question, and that's actually a really difficult thing to discern during the rehab process. And the question was, how can you tell if it's the bone or the muscle that's near the bone, and in kind of what's involved? The thing with the bone stress injuries is very pointed. You can kind of feel it in a spot. If it seems like it's kind of vague and there's like this, like, okay, sometimes it's a little bit here, sometimes it's a little bit there, it kind of wraps into the ankle a little bit, it's just a little bit more vague, that leads me to think that it's more muscular related and that there's something going on with that. But if it's pointed, it's like, oh, it's right here. I feel it right here. And my leg is achy because I can feel this thing right here. That's the bone stress injury itself. So but that's a very good question. It's very difficult to discern that sometimes when I'm rehabbing patients who are kind of like, oh, I feel something, but I don't think it's the bone. And it's kind of partially true as well. Great question. That's tough. Any other questions? Okay. Thank you all. Thanks for coming. I hope you learned something.